Hello, everyone. Welcome back to Plant-Based Kidney Health. I'm Michelle Krosmer. I'm a renal dietitian, and I am joined again with my co-host, Dr. Sean Hashmi, who is a nephrologist.
All right. Welcome back, everyone. Michelle, which episode are we at already?
We're already on episode 5, which we're recording at the end of December, but we'll be releasing it at the beginning of January, which already it'll be 2022, which is crazy. And it's a good place to start with a new year, kind of a fresh slate. But what are your New Year's resolutions?
So I have to tell you, I actually don't make New Year's resolutions because I don't believe in them.
Okay.
I think if you're really trying to change, today is a great day to start that change. And if you focus on it that way, a lot of people, there's been studies done to see how many people stick to New Year's resolutions, and the numbers are abysmal. So what I would say is wherever you are, whoever you are, today is a great day, and now is a great moment to decide what you want to change, and let's go after it.
I love that. I think that's perfect because we never have to wait until the next year or I've always heard things like, oh, my diet starts next Monday, and we don't need to put things off for the future or some future date. It's like if you start today, and again, we've talked about this before, it could be one tiny little change, one tiny little goal that you work on, but starting today is better than starting at some future point. So hopefully everyone, whether it's a New Year's resolution or not, but that you're making some goals and you start today. I love that.
That's awesome. So, but let me ask you, do you have any things that you're really hoping to do in 2022?
So on a personal level, organization is something that is a top priority for me. I think from just a professional level, this podcast and this YouTube channel is very important to me. And, like we said, we are on episode 5, and we have so much more to dive into and questions that people have asked. So I think for 2022, that's a huge focus of mine, is growing this channel, the audience, and getting more people submitting questions.
That's fantastic. Well, I'll say ditto to that, and absolutely, I'm on the same page. Let's grow this channel. Let's help people out. And hopefully, as people watch this and learn about kidney disease, a lot of the basics about what's happening will go away. So tell us, what's today about then?
So today we're talking about diabetes and kidney disease, and we're actually going to be splitting this into a 2-part series because there's so much to talk about. And I'm sure we'll even have future episodes as we get more and more questions around diabetes and kidney health. But at least for today and for this episode, we want to dive into, again, some basics around diabetes and kidney health. We want to help people understand the link between diabetes and kidney health, and some tips and tricks that they can start doing today and in this new year. So with that, I think it's good if you can start with explaining for everyone what is the link between diabetes and kidney disease, and how does diabetes or high blood sugar affect the kidneys?
Yeah, so this is such an important topic today. So when you look at the causes of kidney disease, there's like 70 plus causes that at least I've researched and reviewed and studied on and so forth. But if you say, well, out of those 70 plus causes, what are like the top 3? And I would say number 1 is diabetes. Number 2 is high blood pressure. And number 3 is obesity. And the reason diabetes matters so much in relation to kidneys is because it is the number 1 thing that causes our kidneys to fail. And it is also that thing that we can work on to control how our impact occurs on our sugars and onto our kidneys. So in other words, if you say, is this something that you can take action on right now to control what happens to your kidneys? Absolutely. But keep in mind that diabetes and kidney disease are absolutely guaranteed to be linked. And that's why having excellent control of your diabetes is absolutely critical.
Yeah. And how would you, in a simple form for us, but how do you explain, what is it about high blood sugar? And I've heard people explain this in different ways, but what is it about the high blood sugar that directly damages the kidneys?
Yeah, so imagine your kidneys, they're like a barrier, right? So there's all these little nephrons in them, but imagine it like a barrier. And so what sugar does to this really tight barrier is the nature of sugar is it's toxic to the tubules and to the nephrons themselves. So as the sugar goes inside the kidneys, it actually damages that tight barrier and makes it leaky. So when that barrier becomes leaky, how do you manifest? You start to get very foamy or bubbly urine. And what that means is you're starting to spill what we call microalbumin, or if you look at all the different types of protein, we call it proteinuria, which means protein in the urine. And that's why all of this stuff matters so much, is because once you break that barrier, you can't really go back and fix it. Well, we have strategies to try to take the pressure off the kidneys. But remember, your kidneys are so precious, and you want to do everything to preserve that barrier and don't let that sugar destroy it.
Yep, definitely. And is there any difference? We talk about diabetes in general, but is there any difference in, let's say, someone who has type 1 diabetes and type 2 diabetes and the impact that has on the kidneys? Or would it be the same?
Yeah. So in terms of type 1 versus type 2, the big thing you want to know is type 1 is autoimmune. That's where your own immune system destroys your pancreas. You can't make insulin going on. So these folks actually need exogenous insulin, which means you have to inject yourself, depending on the type of insulin with every meal. There's long-term, short-term insulin. Type 2, what's fascinating about type 2 is insulin resistance, right? So what happens is you get all of this mechanism, which we're going to talk about in a second, where you have these cells that are no longer responsive. So we have medicines which make the pancreas work harder to produce more insulin, or we have medicine or to make the cells become more sensitive to the insulin that's there. So you can sensitize, or you can just produce more. The problem is it's like any worker. If you make a worker work overtime every single day, sooner or later they're going to quit. And your pancreas can also quit if you keep trying to push it. So it's not uncommon for type 2 diabetics, especially poorly controlled type 2 diabetics, that they actually burn their pancreas out and they end up having or requiring insulin injection. So they're behaving eventually like type 1s.
Yeah, I think that's a really good explanation. And like you mentioned with the, the damage that high blood sugar has on the nephrons of the kidneys, whether someone has type 1 or type 2 diabetes, the most important thing is how well is their blood sugar controlled. And, again, with type 1 diabetes being autoimmune and oftentimes earlier onset, someone might have diabetes for a longer period of time and potentially have uncontrolled diabetes for a longer period of time compared to someone maybe who gets in their 40s or 50s. But I think the important thing is with type 2 diabetes is people are getting diagnosed earlier and earlier with type 2 diabetes as well as pre-diabetes. And I've even seen, unfortunately, kids and adolescents with pre-diabetes and even type 2 diabetes. So I think that's something that, is a huge, huge concern, but that's why we're talking about that today and the impact of the blood sugar on the kidneys. One more question for you then around this is, what is considered then well controlled, or how well controlled does someone's blood sugar need to be if they have diabetes and they're looking to prevent damage to their kidneys?
This is an excellent question. And what I would say is, if you're somebody who's age 80 and over, as you know, the standard for what an A1C should be is much higher than somebody who's less than 80. That's not because we stop believing in the idea that you need tighter control. It's that when you're above the age of 80, the risk of becoming hypoglycemic or low sugars is high enough, and it can have devastating consequences that most endocrine societies and other societies, they are a lot more liberal in terms of that going on. When it comes to kidney disease, what we know is that there are people who are pre-diabetic, who we do the kidney biopsies on, and we find out that it's full-blown diabetic nephropathy, which means that the diabetes has attacked the kidneys going on. And pre-diabetes means an A1C from 5.7 to 6.5, and diabetes being 6.5 and above. So the take home there is what we want to see is as much as you can to bring your A1C into the normal range. Now, that means that some people will be able to do it easier than others, but that's a goal to strive for. And even if you don't get there, in the back of your mind, realize that just because we give you an artificial target and say if you're less than 7, it's good enough for government work. No knock on the government. But what I'm saying there is if that's okay at less than 7, still strive to make it better. Because what we know is that the microvascular complications of diabetes can take years. And once we have protein in the urine and kidney disease, most people, what they don't realize is it's not because their sugars are bad now. They may have been bad years ago. And even if you fix the sugars, me as a nephrologist, I'll still struggle to control the protein in the urine going on. So when it comes to sugar control, tighter is better without having hypoglycemic episodes.
I love that. And so it comes down to checking your blood sugars and knowing signs and symptoms of those, hypoglycemia or low blood sugar levels. So good. Thank you for explaining that. That's very helpful.
Yeah. And just to add, there's new ways to check your sugar, so you don't have to keep pricking the fingers, especially people who are type 1s. There are all sorts of new devices out there. Some of them are still very expensive, but I tell you, in the next couple of years, you're going to see the cost of them come down, and you're going to see them become more and more affordable.
Definitely.
All right. Let's switch gears a little bit, because I want to ask you this question, and I get asked this all the time, because patients come back and they are so conflicted about, quote unquote, what is a diabetic diet versus what is a renal diet. So my question is why the heck do these two diets seem to contradict each other?
It's so frustrating. So a couple things, and we'll break it down. But when we think of a diet that is, prescribed or recommended for someone with diabetes, a huge part of it obviously is controlling blood sugar. And usually what people are recommending is that they should be having more fiber in their diet. They should be choosing whole grains over, the white refined grains, limiting things like added sugar in the diet. And so then someone who has diabetes, they're following that, let's say they're having brown rice instead of white rice, whole wheat bread instead of white bread. Well, then they're diagnosed with kidney disease and they start, looking online and they find like, oh, well, now it says that I need to eat white bread and white rice and these refined grain products. And one, that's old and outdated recommendations, but the reason that used to be recommended was that the highly refined white grain products are lower in potassium and phosphorus. And so that's why it used to be recommended that that's what people with kidney disease should consume. But the problem with that is that you don't just transition from having diabetes to having kidney disease. And now the diabetes isn't a concern. It's just the kidneys. You have typically it's both are a concern and you really have to manage both of them with diet. And so we have to keep in mind that, yes, we need to control things like potassium and phosphorus, but if blood sugar is still high, then it's continuing to cause more damage to the kidneys and potentially, causing the kidneys to progress, kidney disease to progress more rapidly. So, that's why mostly it's very contradicting. I think the other thing around that is a lot of times people are recommended, when someone has diabetes, we are looking at, a sign or a symptom of diabetes is high blood sugar, and we want to control that. And so oftentimes people are recommended to be on these low carbohydrate diets, high protein diets, keto type of diets where it's high fat, low carb. And so they are consuming very high amounts of protein and low amounts of carbohydrates to lower their blood sugar. And then of course we get into kidney disease. And like we talked about in past episodes, we obviously see then that these high protein diets, especially high animal protein diets, can be more damaging to the kidneys and more work for the kidneys. So that's another way where they contradict. And ultimately, I think the most important thing is that whether it's with a renal dietitian or your nephrologist or on your own, you have to really look at both diseases and both nutrition therapies for them and combine it. And, as from the whole grain standpoint, there are plenty of whole grains that are lower in potassium and lower in phosphorus, where it's not this drastic difference, right? From brown rice to white rice, it might be 100 milligrams of potassium in a cup of rice, where it would probably take hundreds and hundreds of milligrams of potassium to really make a big difference in that. So that's usually where the contradiction is people are getting old and outdated renal diet advice. And they also sometimes think they just kind of abandon the diabetes recommendation because they now have kidney disease and really they need to be paired together.
So, I think you touched upon some really, really important points here. Let me ask you then, let's kind of highlight what are some of the biggest myths that people have in their head. And already one of the ones that we have talked about in a previous episode is this issue about potassium. But what would you say to somebody who's out there who's struggling and has both diabetes and kidney disease? What are some big myths or big pitfalls as they think about their diet to really say, listen, step away from that area?
I think one of the biggest pitfalls is when we look at the diet as just single nutrients or single micronutrients. So like we're just simply like, oh, I need low potassium. And then we forget about everything else and we hyper focus on that. Or in the example with diabetes is we're just become hyper focused on carbs and how many grams of carbs. And then we forget that at least with type 2 diabetes, it's this disease of insulin resistance. And if we can't just target blood sugar. We need to target what is the root cause of the insulin resistance. So we look at the diet as a whole. We look at the disease process as a whole and the person as a whole instead of just saying, this many milligrams of sodium, this many grams of carbs, because people have different responses to different foods that contain carbs. Not all carbohydrates are the same. Another myth is, people think oftentimes with diabetes that they can't eat fruit and they might see spikes in their blood sugar from fruit. But oftentimes, and what I've seen in clients coming to me, it's because they've been following, maybe they've had poorly controlled diabetes for a long time, or they've been following diets that are low carb, high fat, high protein, and their body just simply doesn't really understand how or isn't able to utilize the carbohydrates. Or sometimes people will put all carbs into this one category of like, okay, well, fruit is the same as a cookie, which is the same as white rice, which is the same as white bread. And we really can't do that because there's a big difference between whole, minimally processed plant foods and their benefits and the fiber content and, added sugars, highly refined foods, and highly processed foods.
So, Michelle, can you then touch on, because a lot of people, they label sugar as either all good or all bad. And so a lot of people then say, well, I can't have fruit because there's sugar in fruit versus, their breakfast cereal should be called a dessert because when you look at the label, it's all added sugar. So what do you do for your clients to explain the difference?
So one of the good things is that food labels have changed, in the last few years where they now designate added sugar separately from total sugar. So you're going to have total carbohydrates, you're going to have fiber, you're going to have total sugar, and then added sugar is in there. So what I recommend is people look at that if you are looking on a food label, because the added sugar, that's where it's going to be in the form of, oftentimes like corn syrup, brown rice syrup, table sugar, coconut sugar, brown sugar, any type of sugar, that is added sugar. And that is basically zero fiber, all sugar. And that, our body is going to digest that and turn that into sugar or glucose in the blood very rapidly. Compared with fruit comes along with fiber. And a good comparison for this is when we look at juice versus fruit. If you were to have a cup of apple juice, you are having to juice a lot of apples to get a cup of apple juice. You get all the sugar from all of those apples, and then all of that fiber is left behind. And the fiber is there to help slow that digestion and, prevent huge spikes in blood sugar or make it so it takes longer for our body to digest that. And so it's not, some people might still see, even with fruit, they might still see some, their blood sugar going higher after a meal or a snack. And there's things you can adjust there. And I think part of that comes along with how sensitive or resistant they are to insulin. But ultimately, especially with fruit, it comes along with fiber. It's not added sugar to the fruit. But if you look at yogurts and cereals and all these things, that's typically where they'll be like, okay, this is a strawberry yogurt. But then you look at the label and it has, 15 grams of added sugar. And it's in the form of like a strawberry puree with corn syrup. That's not the same as eating strawberries. And your body does not process that and utilize that sugar the same either.
Now that makes so much sense. And that's why anytime you have the chance, better to eat the fruit than the juice.
Definitely.
That's great. So,
and I think we both mentioned it a lot, but we were talking about insulin resistance. Mm-hmm. Can you explain a little bit more about insulin resistance, what it is, and how a plant-based or plant-predominant diet can potentially help with insulin resistance.
Yeah. So, when we go back to sort of the nutrition history and we talk about, when people were coming out and talking about things like following a low-fat diet and what the reasoning behind that was, there's been so much debate about whether a low-fat diet actually worked or not. And a lot of people think that low-fat diets really never worked. The truth behind that statement on low-fat diets was that when people went on low-fat diets, they actually didn't cut their fat down. They actually ate more refined sugars, more protein, more animal products, more oils, more everything. So even though as a percentage, we saw a little bit decline in low fat, overall an increase. Now, what's that got to do with diabetes? So it turns out that as the fat enters your cells, just like as the fat goes inside your liver, you get fatty liver. You get all these inflammation and inflammatory processes going on. You get scarring going on. And of course, you get insulin resistance. So the 1-2 hit is the first hit is you fill your cells up with fat. And so then when the insulin tries to act on them to go ahead and dispose of the sugar that's floating around in your blood, it doesn't work. This is the same thing when we talk about, what do you want the sugar to do? You want the muscles to take up the sugar and use it. What you don't want is to have the liver and all of the stubborn belly fat that's there and the visceral fat that's around those organs, that's the worst type of fat, to take up all that sugar and store it. Fat is an active hormone-based organ. And so what we're finding out more and more about the fat that we store is it releases so much inflammatory markers. So with diabetes, what ends up happening is as people eat these really processed foods and high-fat foods, we're not talking about healthier PUFAs or MUFAs, which is polys or monounsaturated fatty acids. We're talking about really refined stuff, your really fried French fries that are rich in saturated fat because that's what makes them taste good. Right? A lot of people, they go for the taste because fat actually tastes good. But the problem is even though you think it tastes good, you're doing yourself so much harm. And if you switch over to fruits taste great and they're going to make you live longer. So at the end of the day, the bottom line with diabetes is it creates insulin resistance by getting all this fat. Then you throw all this sugar in there and the sugar has nowhere to go. So it starts to damage your eyes, your brain, your heart, your kidneys, your lungs. You name an organ and it's being damaged by all the sugar floating around. And that's the 1-2 punch that we talk about when it comes to diabetes.
Yeah. And in the dietitian world, we always like to compare or explain how our body is utilizing insulin, with the lock and key and, basically the insulin needs to, be that key to open the lock and let blood sugar get inside those cells. But it's not just about sugar in the diet. It's where if there's a lot of the fat, like you talked about, then that can gum up the key and, or gum up the lock and basically make it so that key is not working properly. And so I think that sometimes it's, a good way to look at it. And we can't just blame, it's not like high sugar diets are the cause of diabetes. It's, insulin resistances, and it's more than just sugar that impacts insulin resistance. It's the saturated fat and the fat that's in these, fast food, restaurant food, highly processed food, junk food that is so common in the standard American diet.
And, what's another point that you raised was what about people who are focusing on a plant-based diet? The difficulty that we're facing now is there's 2 types of plant-based diets, right? It used to be that when we talked about a plant-based diet, we meant a whole foods plant-based diet. Now there's a highly processed plant-based diet. And so a lot of people who say, I'm a vegan, that's great, but you also want to focus on the quality of food. And so you're focusing on minimally processed as much as you can, whole food, plant-based diet. And that's what's going to help you. So that's the diet that's naturally low in fat. But the other version, which is the unhealthy, highly processed plant-based diet that we're starting to see in the form of lots of very convenient packaged products. So I'm a bariatrician, and one of the concerns that I have is I'm starting to see patients who are following plant-based diets and they're gaining weight. And when you ask them what they're eating, it's so shocking because it's so bad for their overall health, but in their mind, they think that they're actually trying to do some good.
Yeah. And that's what makes it so confusing is the marketing, of packaged processed food, the food industry and fast food is they've noticed this trend of, okay, well, plant-based, there's all these health benefits that now, of course, you can get plant-based burgers, plant-based chicken nuggets, plant-based, all sorts of ice cream sandwiches and all these things. And that's, yes, it's not an animal product, but it is nowhere near the benefit of a whole food plant-based diet. And it potentially still contains a lot of highly processed ingredients, lots of added sugar, lots of the same thing too. There can be a lot of saturated fat that's still, because of the oils used, still in these plant products. So I think it's important whether someone's fully plant-based or not, that they're looking at the quality of the food that they're consuming. And no one's expected to be perfect by any means, but it's, what are you doing 85-90% of the time? And then you still have flexibility in your diet, but it's not, I think that's where it's really important. Write down for a couple of days what you're actually eating, how often you are eating out, because sometimes we just think of eating out as going to a restaurant and we don't think of it as going to a quick fast food place, or we don't think eating out counts for lunch or breakfast. It only counts for dinner. And so I think it just comes down to assessing where you are and making it a conscious effort to make some changes to your diet.
Agreed. All right. Final question for you, Michelle. So let's segue from here. So let's say somebody does have diabetes, somebody does have chronic kidney disease, and they're trying to make a transition to a more whole food plant-based diet. What are some things that we can help them out with in terms of controlling their blood sugars and really just tips and tricks that they can do to start that transition? Yeah.
So I think, again, one of the most important things is knowing where you're beginning. And so ideally, someone who has diabetes is checking their blood sugar. And one of the things that you mentioned earlier about, not having to prick your fingers so much, but I actually have a client who she uses her earlobe because she says it doesn't hurt at all. She doesn't, it's not as thin of skin, of course, as on your fingers. And she uses her earlobe to get her blood to check in her glucometer, which I just thought was really interesting. But ultimately, if you are, check your blood sugar, know your levels. And then if you're keeping, whether it's on an application or a Word document on your computer and your phone, or just simply in a notebook, writing down what you're eating and then what your blood sugar is when you check it, and keep that as part of your food journal, because then you can go back and you can compare, oh, my blood sugar is really high this morning, or a couple hours after I had lunch, my blood sugar spiked really high. And you can go back and look at your food journal and compare and see what you've eaten and see if you find trends in anything that you've been eating. And so I think that's a really good place to start. And then ultimately, I think fruit can be tricky for someone who's very insulin resistant, and it's not something that is permanent. I've had clients who could barely eat 3 strawberries without their blood sugar spiking really high, who now eat bowls of blueberries and strawberries and have perfect blood sugar. So just like you said, it's, some people have diabetes and high blood sugar for months to years at a time, and it's not something that just changes. So be patient in that. But ultimately, the non-starchy vegetables are things that we really want people to be adding more to their diet, and those are not things that spike blood sugar. And so our starchy vegetables are things like potatoes, corn, and peas. And again, that doesn't mean you can't have those. Those are just more starchy and contain more carbohydrates. And the non-starchy vegetables are pretty much everything else, our leafy greens, green beans, bell peppers, broccoli, cauliflower, eggplant, kale, all of these other vegetables are non-starchy vegetables. And those are things we want to be bulking up on our plate. One, because they are a huge part of a plant-based diet. They are protective for the kidneys, but they also help control blood sugar levels as well, and can add fiber to the diet to help you feel more full and satisfied. And then another tip around that would be fiber, and being mindful if you are tracking and logging what your intake is, look at how much fiber you're consuming and looking at it on a, per meal and per snack basis. And so I think one of the common foods that I hear people both in the diabetes world and kidney world say they can't have is oatmeal. And people are scared of it in the kidney world because of potassium and phosphorus. They're scared of it in the diabetes world because, it is a carbohydrate food, but oatmeal is a whole grain. And yeah, if you just eat oatmeal, or you eat oatmeal with bananas, you might see a spike in your blood sugar, but there's things where you can control the portion of the oats. You can add things like flaxseed, chia seeds, hemp seeds, use berries, which are going to be lower in sugar and higher in fiber, maybe some walnuts to get some healthy fat in there and a little bit more plant protein. And now you can take a meal that might spike your blood sugar, probably isn't going to stick with you very long, and make it higher in fiber, more satisfying, and it can fit both a kidney protective diet as well as the diabetes diet.
Well, that's fantastic. Now, I know we got so much more to talk about, but we're going to do another episode to make sure we answer everybody's questions. So any final thoughts, Michelle, before we sort of end this?
I think overall, I think it's just awareness, right, is huge. I think knowing that you have prediabetes or you have diabetes is super important. And being aware that that does impact the kidneys, and you don't have to go from, if your blood sugars are normally 200 and you get them down to in the 150s, which is still considered high, that's still a lot better. And that's helping your kidneys and helping your, really your whole entire body. So I think it's just remembering that small changes are going to progress over time and can really help you see big results.
So bottom line, progress over perfection. Thank you everyone so much for checking us out for this another episode. As always, we'd be so grateful if you guys would go ahead and share this. Please hit that subscribe button. If you want to see a question being answered by us, please go ahead and email us, put it in the comments. Our email is plantbasedkidneyhealth@gmail.com, plantbasedkidneyhealth@gmail.com. And as always, from Michelle and I, thank you so much for taking the time to learn a little bit, to improve your health. We are grateful that we can be a part of this journey with you guys. And once again, happy 2022. No matter what your New Year's resolutions are, as always, today is a great day to start that change right now.
Yes. Happy New Year, everyone. And we look forward to talking about diabetes in part 2 next week.
Thanks, everyone. Bye-bye.
Bye.